Hey, crazy keto friends. This is Dr. Steve Riggs here from Living by Design, Keto Nutrition, and just want to welcome you again to another Zoom session on real science, real food, real results. And we want to cover a couple misconceptions of keto. Last week we covered does keto cause kidney or liver disease? The answer was a resounding no. And tonight we're going to cover a couple more, some common misconceptions that I hear from people in the clinic. So let's get right to it. So one of the things I get questions about was, well, does keto cause brittle bone problems, osteoporosis, that kind of thing? And I think where that comes from is that they're thinking that, well, osteoporosis is caused by the leaching out of calcium and phosphorus that comes from out of bone, leading the weakening of the bone structure, and that's true. And they think that comes out because the body neutralizes acidosis by leaching out calcium and phosphorus from the bone, which is false. And that happens when you burn protein, like when you metabolize protein, that leads to acidosis, which again is false. And another false conception is that keto is a high protein diet. So the kind of the thinking here is that, well, if you eat keto, it's high protein. And if you eat a lot of protein, then that leads to acidosis. And acidosis is neutralized by leaching calcium and phosphorus out of the bone. And basically, most of those are false to begin with. It is true that metabolic acidosis does often lead to osteoporosis. That's true, but metabolic acidosis is most commonly due to kidney disease. So it's a kidney problem to begin with. And that's it's a separate issue. You're not going to get acidosis from eating a steak. That just doesn't happen. So the truth is that bone really is not involved in acid-base balance. It's the kidneys and the lungs that are the main organs there. The kidneys adjust the pH of the urine to maintain proper blood pH, which is kept within a very narrow range. It does that very well. And the lungs are also used to blow off carbon dioxide, which adjusts your bicarbonate concentration in the blood. And again, the balance here is very precisely kept. The ketogenic diet, as I said before, is not a high protein diet. Remember that it's about 20% protein, which is a moderate protein diet. It is an extremely low carbohydrate diet. About 5% of energy comes from carbohydrates. And it's a very high fat diet. About 75% or so of energy is coming from natural fats. So although it is true that a high protein diet can lead to increased urinary calcium excretion, and that's been known since the 1920s, it's also been known that it's counterbalanced by increased calcium absorption in the gut. So again, eating a higher protein diet, even if this was a high protein diet, does not cause acidosis, nor does it cause leaching of calcium or phosphorus from your bone. There have been multiple studies looking at this leading up to this review and meta-analysis from the National Osteoporosis Foundation themselves. And what they said, end quote, was current evidence shows no adverse effects of higher protein intakes on bone health. In fact, what they showed was that there were trends on bone mineral density at most bone sites that were higher or positive with higher protein intakes. So conclusion here is pretty quick and easy, that the ketogenic diet has no adverse effects on bone health, and that even though the ketogenic diet is not a high protein diet, dietary protein doesn't cause acidosis nor bone loss, and in fact likely increases bone mass anyway. So no problems here with keto and bone disease. Well, let's look at another bone problem, if you will, and that's gout. Does keto cause gout or increase gout flares? This is a classic old picture of a typical gout patient back in the 1700s. You could see he's an obese man, drinking wine, eating a lot of fruit and other things. And then you got this little demon down there taking a hot coal from the fire, and he's going to touch his great toe. And this is just a classic picture of gout. If you've ever had gout before, you know what it is. It's an extremely painful, inflammatory arthritic condition. And it's caused by the precipitation of uric acid crystals out of solution in your bloodstream, which go into the joints. And they're actually microscopic little needles. And that induces an extremely profound inflammatory response, and it's very painful. The most common joint affected by this for some reason is the big toe. That's just as an extremely classic presentation. I mean, like people with a gout attack just can't handle the sheet being on their toe. It's so painful. Well, where does uric acid come from? It comes from the breakdown of purines. And what are purines? Purines are the building blocks of both DNA and RNA. So they're very common. They're produced in your body naturally, and also you get them from certain foods. So traditionally, to reduce the incidence of gout, we've recommended that people eat foods that are low in purines, avoiding foods like seafood and liver and organ meats and meat in general, along with beer, wine, and certain cheeses and so forth. But does the gout diet actually show any benefit? Actually, there's only been 3 randomized controlled trials on diet on gout, and actually none of them showed a benefit. There were 2 Cochrane reviews. Cochrane reviews in the medical literature are very extensive reviews looking at the latest information on well-done studies. And 2 of them showed that there was no high-quality trials to support or refute the use of lifestyle interventions for treating acute or chronic gout. Well, even if you do follow a low purine diet, which most people don't, and you can only lower your uric acid level by at most 1.5 milligrams per deciliter, which is not a great amount. So there's no really good evidence that the standard diet that we give people for gout has any proven benefit to begin with. Well, does that mean that there's no effective treatment for gout from a nutritional standpoint? Well, probably not. And actually, the ketogenic diet is being looked at more and more in gout treatment because gout, as it's been studied, is associated with hyperinsulinemia and insulin resistance. If we go back and look at this picture of this man, you can see that he's the typical kind of picture we see with the obese, hyperinsulinemic, diabetic kind of patient that we see who's very insulin resistant. And that same problem is underlying gout. Insulin, we know now, causes retention of uric acid, and gout flares are precipitated by activation of what's called the NLR3P inflammasome. So that big inflammatory response is precipitated in gout. What we also know is that beta-hydroxybutyrate, which is our friend that's produced from the ketogenic diet, inhibits that NLR3P inflammasome like very strongly. So maybe the focus should not be so much on reducing purine intake in your diet, which is pretty ineffective and usually is a high carbohydrate diet, which leads to hyperinsulinemia and insulin resistance. But maybe we should try to lower inflammation and hyperinsulinemia. In fact, rather than can a ketogenic diet cause gout, can a ketogenic diet prevent gout? Well, there's actually some data to support that. So this was a study published in the Annals of Rheumatologic Disease, looking at the ketogenic diet on both uric acid levels as well as gout attacks. And what you can see here is that in the 16-week trial, yes, uric acid levels fell, but gout attacks dropped dramatically for the vast majority of people. And that's pretty dramatic for any dietary intervention. This is a study that looked at the Atkins diet, which is a low carbohydrate ketogenic diet on uric acid levels. And again, at 6 months, you can see some pretty dramatic drops in uric acid levels, the most occurring with those who had very high uric acid levels to begin with. The authors concluded that our findings suggest that the Atkins diet, i.e. a high protein diet without calorie restriction, can reduce serum uric acid levels despite substantial purine loading. This effect may be more pronounced and clinically meaningful among those with hyperuricemia or obesity. So in other words, even if you eat the Atkins diet, which they describe as a high protein diet, okay, it's just a very low carbohydrate diet, does reduce serum uric acid levels a lot, despite substantial purine loading, meaning you're eating foods like meat and liver maybe, and other foods that are high in purines to begin with. And so eating purines doesn't seem to be a problem, and the Atkins diet can lower serum uric acid levels dramatically and gouty attacks. Yale researchers have shown, in fact, that beta-hydroxybutyrate, which is produced on the ketogenic diet, blocks the NLR3P inflammasome, which is a major cause of inflammation in gout. And the team found that the ketogenic diet raised beta-hydroxybutyrates, lowering that NLRP3 inflammasome. And as a consequence, urate crystal-induced gout symptoms were alleviated, like really reduced. So this is pretty amazing. And that reduction in inflammation comes without causing a lot of the problems that you can see with medications that would do the same, like increasing your risk of infection or cancer formation. And additionally, beta-hydroxybutyrates block something called the interleukin-1B in the neutrophils of both animal models and in humans, regardless of their age, and that also reduces inflammation. So in conclusion, does keto cause gout? Absolutely no way. In fact, keto may be much more effective at reducing uric acid levels and gout flares than the standard, quote, low purine diet. It's the one I would recommend now if you have hyperuricemia and gout attacks. Definitely would recommend keto. Gout is caused by the same conditions, in fact, that lead to insulin resistance, and the ketogenic diet's actually the most effective way at treating that. Reducing hyperinsulinemia and beta-hydroxybutyrate inhibits the inflammatory response that causes gout to begin with. So it's a win-win for a lot of things in gout. So again, 2 more myths about the ketogenic diet bite the dust: keto and gout, and keto and osteoporosis. So I hope you'll join us again next time for more on the ketogenic diet and keto nutrition. Until then, we look forward to seeing you back here. So we will talk to you later. Thanks.